Hello, my name is Monifah Cooper. I typically go by Mo. My presentation will be the discussion of restraints in healthcare. Throughout this presentation, we will be discussing the learning objectives, introducing the topic of restraints and what they are, the influence that restraints have in healthcare, as well as their impact and the impact that affects society. At the end of the presentation, the learner will be able to do the following: identify at least 2 different types of restraints. They will also be able to determine the influence that restraints have on nursing practice. Additionally, they will be able to identify 2 ways that restraints impact healthcare. Restraints, what are they? They are devices that assist in limiting a patient's movement. While devices are typically the forefront in thought when someone mentions restraints, restraints can actually be any action that prevents the free movement of a patient's body in which they cannot easily be controlled or removed by the patient themselves. There are different types of restraints devices such as belts, jackets, mittens, and wrist bracelets. The type of device is dependent on the type of situation that is needed for the patient. Restraints can actually be used for multiple reasons. They can be used to help keep a patient in place to prevent them from falling, such as being restrained on a stretcher while during transport. And they can also help prevent harmful behavior, such as picking or scratching at skin, combative actions, such as any kind of physical harm to others around them or themselves. The importance of restraints. 2 topics that typically stand out are fall prevention and the moral dilemma that circles around restraints. Fall prevention has actually become more popular with the use of restraints. While being used as the last resort, it helps prevent potential injuries that could become fatal towards the patient. They're especially used in fall prevention if said patient is confused. Looking towards the moral dilemma, patients' rights are heavily taken into consideration when restraints are being discussed to be used. Restraints are only used as a last resort to help the patient. Additionally, restraints can cause emotional distress in addition to physical damage to the patient. Restraints can have both positive and negative influences. Positively, restraints provide a sense of security and safety to others. The theme of support or providing a safe environment heavily influences the use of restraints in dire situations. It gives healthcare professionals forms of both physical and psychological support. This can include gaining a sense of security, as well as providing nurses with opportunities to provide therapeutic communication and to provide physical support for assisting patients with their daily needs, such as drinking and eating, doing their hygiene routines, or even toileting. Negatively, though, restraints promote physical and emotional damage or negative experiences. Restraints can influence or promote negative feelings or change the patient's state of mind for the worse. These negative feelings can be things such as fear, anxiety, anger, or helplessness. Additionally, restraints can also physically injure a person if not properly used. Restraints have the potential to leave marks as well as leave a stiff and sore sensation to the patient. Restraints can have an impact on healthcare through safety and the nursing ethics. Safety-wise, restraints can be used to help in life-saving situations, but they can also affect the way the patient responds to the nurse. The rapport that is built with the patient can be damaged in the process, as well as causing irreversible trauma to the patient. Additionally, family members can respond negatively to the use of restraints. This impacts healthcare as the nurses will need to provide more education and reassurance to both patient and patient's family. Restraints impact the process of providing care by requiring staff to be properly trained. Patients must be assessed more frequently than others that are not in restraints. Staff also must be trained in proper de-escalation techniques, as well as proper indications for the use of restraints. Nursing ethics. Ethical judgment is required when it comes to the use of restraints. The principles that restraints will be involved in are autonomy, justice, beneficence, and non-maleficence. Autonomy is when the patient has the ability to make their own informed decisions about their care. The use of restraints without permission technically is violating the patient's autonomy. Justice is fair treatment among patients. The improper use of restraints is unfair and lacks treating the patients as if they are humans or equal. Beneficence. Interventions should benefit the patient. The use of restraints can be seen as a protective intervention, thus beneficence, and is an obligation to appropriately provide care to the patient. Non-maleficence means to do no harm. The goal of physical restraints must positively outweigh the adverse damage that may occur from physical restraint use. Restraints can cause physical damage and emotional pain to the patient. Society is impacted due to the perception that the use of restraints can give. TV or movie depictions of restraints are in a negative light, or the restraints were shown to be used as punishments. Restraints in the hospital setting are not used as punishments. They are used as tools to prevent injury or to prevent the patient from dislodging life-sustaining tools. Society has a conceived negative perception of restraints that can be combated with education and reassurance. Restraints can be both devices or actions that restrict a patient's movements. Restraints can positively and negatively influence a patient's care and treatment plans. Nurses should consider the nursing code of ethics when using restraints. Restraints can impact society negatively due to the negative stigma or situations they can cause.